Hello everybody, my name is Dr. Vince Gutierrez. I am a physical therapist. You can find me at movementthinker.org. You can find me practicing out of primary care Joliet, currently in Joliet, Illinois. You can find me at the DPT Mentors page. You can find me on Dr. Vince Gutierrez Facebook page, right? I'm a movement thinker on Twitter. I'm all over the place. Anyway, so we've covered your history, us chatting back and forth. We've covered us looking at your posture. We've covered us looking at your reflexes, your sensation, your strength, your dural tension, neurodynamics, like I said last session. And we've covered looking at your single leg stance. Next, we're going to cover how do you move? What does your movement look like? And when you move, what happens to your symptoms? And so the first thing that we're going to do is we're going to have you bend over and touch your toes. You don't understand how many people are so afraid to bend over and touch their toes. I have literally had a stare down with somebody and said, I want you to bend forward as far as you feel comfortable going and touch your toes. And that's the response. I was told never to bend forward and touch my toes. Really? Who told you? My physical therapist. Damn it. Sometimes seeing a therapist who's afraid of a movement brings that fear of movement onto the patient. That makes sense, right? And so if the therapist is afraid of pain, it makes sense that the patient's afraid of pain. If the therapist is afraid of bending a patient forward, the patient's going to be afraid of bending forward. And so you shouldn't be afraid of bending forward, right? You put on your shoes and socks and pants, I hope. Right? I mean, sometimes you should see how I'm doing this video now. But I'm kidding, obviously. Actually, I'm not. But you put on your clothes, you bend forward. There's nothing wrong with you bending forward for us to assess your motion and see how well you do. When a patient refuses to bend forward, that refusal actually gives me a ton of information about that patient. Because now, not only do I have to try to help this patient's symptoms, not only do I have to try to get this patient to move better, I have to get into this patient's brain and figure out how to change their basic belief patterns because they have a fear of emotion that is not dangerous. And that's something that has to be broken. Every movement is a good movement if the movement is built up appropriately. Now, if you don't build up the movement appropriately, if you've never bent forward to touch your toes and I ask you to pick up 500 pounds doing that, that's my fault, right? That's bad on me. But to bend forward to touch your toes is not a dangerous movement at all. And when you do that, I want to know, how does it affect your symptoms? Do you get better? Because some people do. But if you avoid it, you'll never know if that's you. Right? It's a small percentage, only like 5%, but still, some people do. Does it change the symptoms down your leg? That tells me a ton of information because it tells me about neurodynamics and do the nerves like to be moved in that fashion? Are you blocked? Can you just not go any further? And that tells me a little bit about your symptoms. The next thing that we look at is how far can you bend backwards? I personally like to stand next to the person. You heard me on my last video talk about single leg stance, and it should always be done under the supervision of a medical professional. Having patients bend backwards, I always stand next to the patient because some people, they're just, to coin a term that I got from a physiatrist that I used to work with, she called some patients motor morons. They just don't know how to coordinate motion. And when they bend backwards, they fall backwards. And so I stand there just to make sure that they don't fall. Ideally, you should be giving them the cues to let your pelvis sway forward when you lean back, because if you don't do that, you go backwards, right? So you have to make sure as a therapist, you're giving the cue, watching you. But as a patient, you should have your therapist right next to you when you're trying to do it. And if you're losing your balance, we have to give you better instructions. And again, when you do the motion, one, how far do you move? How well do you move? How fearful are you of movement? And what happens to your symptoms when you move? The last two motions we do are called side gliding. If you're a therapist and you're watching this and you've never been taught side gliding before in your classes, interesting. I can tell you personally, I was never taught side gliding when I was in PT school. I don't know if it's still not taught. They teach side bending. How far can your fingers go to the floor? And that's good. I can go into the research, but there's cases where you want to do side gliding, where you move your pelvis. And there's places where you want to do side bending, where you move your fingers. And you have to, as the therapist, you should know the difference. As the patient, you have no clue when one should be applied over the other, which is why you need to be in the presence of a therapist that really understands spine. Because if your therapist was only taught spines in school and never really followed up with anything, they don't understand the difference between why you should do one versus the other. or when you should do one versus the other. Make sure you're being treated by a competent healthcare professional. Moving on. That ends the basic baseline measurements. From here, what we do is we now have an idea of where your symptoms are, what turns on your symptoms, what turns off your symptoms, how your symptoms react in certain situations, how your nerves are, how the nerves affect your strength, what's the communication like between your brain and your body, that coordination issue, how is your posture and how does your posture affect your symptoms, how well do you move, do you have any sensory limitations, can you feel things, how are your reflexes, and how are your neurodynamics? Thank you, John Ware. How are your neurodynamics? We have a ton of baselines now from which to go back and check. And it is your therapist's job to figure out which baselines, which of those that you're starting with, is the most important for us to keep track of. Because some things trump others. And your therapist should know that, and you should know that if you're having strength loss and sensation loss and reflex loss, those are all really big deals. And that needs to be tracked to make sure that that's not worsening over the course of time. And your therapist needs to be able to tell you that if they're worsening over the course of time, you should be referred back to the physician, because that could be kind of important. Make sure you're seeing somebody who actually cares about you as the patient and not about you as a dollar sign, because the only incentive for sending a patient back to a physician or other healthcare provider aside from a physical therapist is the benefit of the patient. So make sure you're with somebody who actually cares. Thank you for watching. We're almost done with this evaluation segment.